Welcome to Get Naked with Dr. Kate. I'm your host, Dr. Kate Balestrieri, a Beverly Hills-based psychologist, certified sex therapist, and the founder of Modern Intimacy. Thanks for joining me here where I talk about sex, relationships, mental health, and dive into your questions with practical answers and real solutions. Each week, I share insights aimed at helping you build an authentic and healthy relationship with yourself, with others, and with your sexuality. It's time to get naked, emotionally, mentally, and on your own time, physically. Welcome back, everyone. I'm Dr. Kate Balestrieri, licensed psychologist, certified sex therapist, the founder of Modern Intimacy, and your host of the Get Naked with Dr. Kate podcast. I'm so excited today to be speaking with David Khalili. He's a licensed therapist, a board-certified sexologist, and the founder of Rouse Relational Wellness, a boutique sex and relationship mental health wellness therapy center serving San Francisco and all of California. David has a new book out, the Mental Health Workbook for Men, Exercises to Improve Your Emotional, Psychological, and Social Well-Being. And he recently published this to help men improve their relationships with themselves and others. David, thanks so much for joining me today. I'm really excited for this conversation.
Thank you so much, Dr. Katie. I'm happy to be here.
Yeah. What got you started in thinking about creating a mental health workbook for men specifically?
Yeah, so to go way back in time, I grew up first generation American born. Both of my parents immigrated here from different countries, very different religious backgrounds, but sex and relationships were always something that we talked about openly in my household and joked about. And I noticed in high school and in college, people were really uncomfortable talking about sex, and especially some of my guy friends, they would kind of joke about it, but then not really talk about it directly. And then for myself personally, I also noticed, being queer, being mixed race, multi-ethnic, that I often felt like I wasn't enough, or I was told that I wasn't enough to fit into one category or one identity. And that definitely added a lot of issues for myself and my own kind of identity formation, identity journey, if you will. And so I really wanted to create my practice, Rouse Relational Wellness, and also the book as a way to help people feel like they can really integrate all their parts, that, we're all a collection of beautiful parts within ourselves. And so over time with my practice, I've been in mental health for about 15 years and sexual wellness for about 20 years, but Rouse is about 2 years old. And over time, I've worked with a lot of men who really had challenges accessing their emotions. Myself, I had a lot of challenges accessing my emotions in my younger years, and noticing the stigma, experiencing the stigma about accessing emotions, talking about emotions, really, really motivated me to create this workbook and create my practice in a way where men and people that are, in relationships with men, whether it's romantic or familial or platonic, that these men can have a way that they can really be all of themselves and not feel like they have to show up in a certain way in order to be accepted or taken in.
Yeah, I so appreciate that perspective. It I think what I'm hearing is that you understand this very unconscious experience of normative male alexithymia that so many men don't even realize they are walking around holding as an approach, or rather an avoidance of emotions or a disconnection from emotions. And it's a part of the gender role social conditioning that a lot of men get systematically disconnected from their emotions over time. And it makes it really challenging for them to have a really productive, conscious, and agentic relationship with their emotions as adults.
Absolutely. Yeah. And someone that I truly look up to and wrote about in my book, and actually talked to some other authors of men's mental health books, and we all kind of joke that we're referring a lot to Bell Hooks, and I hope she's okay with that. But I think it's like really amazing work that she's written, and the book, The Will to Change, is a truly transformational book out there. And she talks beautifully about the concept of soul murder, where boys that are growing up, they're taught systematically, like you're saying, that they can't have access to certain emotions, and over time they consciously and unconsciously kind of kill off parts of themselves in order to fit in. And I see a lot of rage coming from that, a lot of dissociation, a lot of sadness, loneliness. And so, yeah, my mission is to really help guys talk more comfortably about emotions, about sex, about relationships, about their needs.
I really appreciate you bringing up Bell Hooks. She was such a compassionate writer for everyone. And one of the things I love most about her work, and I think it's in that book, is that she talks about how young men are the first victims of patriarchy because of this soul murder and because they are consistently distanced from their fullest experience because of the shaming around even knowing their emotions, let alone expressing them.
Yeah. Yeah. And yeah, my hope is to really help kind of build up more of that access, whether it's through books or, podcasts like this or other modalities, other mediums.
Well, I think your workbook is a really important and interesting bridge for a lot of men, because in the work that I've done with many men, it's easy for us to say, feel your feelings, right? But what does that even mean? And when you're so disconnected from your feelings, a lot of men, I think, feel frustrated when they're first learning about their emotions because they don't have those muscles developed yet. And so it feels like they're sort of free falling into a chasm and they don't know what to do. And they feel often really demoralized in the work. And so I see books like your workbook as a beautiful bridge because a lot of men want to do. And so the workbook gives them something tangible to do that they can start, little by little inching into the feeling and the being of being a man.
Yeah. Thank you for naming that. Yeah. I've noticed also, in previous times, I really like dialectical behavioral therapy and acceptance and commitment therapy. And there's been some times with male clients of mine where we kind of hit this frustrating stuckness. And I've just kind of grabbed a book off of my bookshelf and here, just go home and work on this and we'll talk about it later. And was surprised that, okay, they followed through. And I think it's also about your relationship to learning. A lot of guys are raised in a way where they're supposed to just know. And I know you've talked about this and we talk about this sometimes, especially guys who have sex with women, feeling like they just have to know how to have sex, how to give orgasms, as if there's no kind of
subjectivity.
Right. Yeah. And so, also working on the fact that it's okay to learn, it's great to learn, it's exciting to learn, you're going to make mistakes, but, so hopefully by doing it with a workbook or with a trusted therapist, that they can learn how to make those mistakes and learn how to learn and be okay with going slowly if they need to.
Yeah. You outlined several core areas of impact in your book that men are, I'll use the word vulnerable to, even though I'm sure men listening will bristle even hearing me use that word.
Right.
But I think that the categories you outlined are vulnerabilities for men because of, what we're talking about right now.
Yeah, I think some of them are, comfort talking about sex is a big one. A big mission that I have right now is also to help men talk to other men about sex and emotions. I think a lot of men were raised in a way where they felt more comfortable talking to women and femfolk about emotions, about needing help. And so some of the men's groups that we run here are really geared towards helping guys feel that vulnerability of giving support, seeking support from other men. I think anxiety gets in the way of consent sometimes. I was just on Mistress Midori's podcast, and we talked about anxiety and shame getting in the way of consent. And I think there's an anxiety around chasing your orgasm, especially for guys who have performance issues or concerns about performance issues, and they just want to come orgasm. And so what ends up happening is they end up disregarding their own boundaries and needs. They disregard their partner's boundaries and needs. So there can be consent violations or boundary violations. And I think shame is a big thing that men face, lots of people face, but for this conversation, men face. And again, around learning, around doing it right, around, having sex in the right way, or around expressing emotions in the right way. Those are big ones that we see.
Yeah. I'm, oh, my dog agrees. Um, I'm hearing a theme, right, around having to look or be experienced as perfect or without fault. And I wonder if you can speak a little bit to how this workbook or how men in general can really challenge that need to be perfect and kind of embrace leaning into the imperfect.
Mm. Yeah, one thing that I like to model is when I don't know something, I admit it. It seems really simple, but I think for a lot of guys out there, there's this pressure to, like I said, know everything and to just kind of fake it till you make it. And so, again, the encouragement of learning, the encouragement of making mistakes, the encouragement of playing around, being playful and creative. And, um, you know, one image that I like to say with some guys that I work with is, um, let's just throw out our ideas in between us and kind of point to the rug between us and we can just kind of pick through and go through them. Or I say, imagine this scenario or this emotion or this issue as like a sculpture that you're looking at in a museum and you're looking at it from all angles and you're just kind of walking around it. And so just encouraging that, being exploratory, not being transactional, and being really curious.
I think that's beautiful. I hear that it creates more dimension in the room that you're in, right? When you're addressing
Mm.
a problem or a topic or a question. And that curiosity invites some added layers and complexity that maybe are hard to see when somebody's invested in being seen as right or infallible.
Right, right.
Yeah.
Yeah. So just admitting I don't know, or can you help me, or what do you like? Those are all great questions to ask or to say.
So, when you talk about your workbook, I've heard you say things like the workbook helps men break through stereotypes and it approaches men of all different lifestyles, backgrounds, sexual orientation, gender, and really kind of moving through this need to be perfect and like always strong, always confident. And like, let's talk a little bit about what that when men can't get there or they haven't gotten there yet where they can accept their imperfections, what can they expect to see in their day-to-day lives, in their relationships, in their sex lives? And also, what do they start to see when they actually do lean into being imperfect or not having to be seen as somebody so strong and powerful all the time?
Mm. So I think for the first part, what they're seeing when they're having a hard time accessing their emotions is, they may feel like some brain fog. They may feel agitated. I hear from a lot of guys that they just get really frustrated that they can't really label what's going on for them. So they may have like a short temper or like it becomes easier to get frustrated sometimes. Where oftentimes like blaming others for their emotions or blaming others for their reactions. And what ends up happening is when they start to access their own muck, their own stuff, they can start to take ownership. They take ownership of their capacity, their reactions. They may say like, "Oh, that triggered me," but they'll be able to say like, "But it brought up this within me, and this is something that I need to work on." Or they may hopefully start to kind of understand their capacity for things, to know like, I can't work the 12-hour days that I used to. This is me back when I was bartending. Or I can't, do whatever it is, but to know that they don't have to kind of be the Superman or whatever, that they can just take everything and take anything. And one thing I talk about in my book is, and it's quoting Rick Hansen, who talked about resiliency. That resiliency isn't just being able to like take anything and everything. Resiliency is actually like knowing your capacity, knowing your boundaries, and knowing how to say your boundaries as well. And so that's my hope of where we can, where guys can get to once they start to understand their emotions more.
Yeah.
You have your own goals, you have your own accountability, you have your own values that you follow. With acceptance and commitment therapy that I really like. One of the reasons why I like that, the same with out of control sex behavior modality, is,
Mm-hmm.
it's really values based. It's okay. What is your value? Or what are your values? And I really appreciate that, especially because it has this way of, we're not telling you what to do. We're helping you identify for yourself and helping you follow it. So I think that can be the positive piece of, being productive or having that expectation on yourself. It can give a sense of like confidence, knowing you have the ability to see something through. But yeah, the other piece, it can really instill shame and anxiety if you have this like thin margin that that you can meet for success. Then there's so much possibility of failing, or of humiliation or whatnot. And then depending on how what expectations you hold yourself to, or what your trauma history is like, were you bullied excessively by other kids, by parents, by caregivers, teachers? What voices have you internalized in order to like keep you perfect? And then what do you do when you find yourself not being perfect? Do you just hide for a while? Do you go to substances? Do you act out in certain ways? Do you harm yourself in certain ways? Yeah.
Yeah, I mean, you've mentioned a few things that seem to come up a lot in terms of themes, not just with men, but certainly I see it amplified with many men. And particularly what comes to mind is the relationship between shame, withdrawal, and difficulties with accountability. I wonder
Mhm.
if you're seeing connections between those three things at all.
Yeah. Yeah. And I think that's why like shame is the important piece to look at, because if you take away, or as best as we can take away some of the shame, then there is the willingness to see yourself as multiple parts. That just
Mhm.
because you didn't do well in one thing doesn't mean that you're bad in its entirety. And so working on the shame piece can then make it more or less risky to admit a fault. Then you can say, okay, the teenage part of me came out and got excited, and that's why I bought that new thing or whatever. Yeah, I think then it can really kind of take away some of that pressure, that surveillance that we have inside ourselves.
Yeah, I think it's really liberating for a lot of men to start leaning into that. Like once there's a little bit more comfort in just being able to take ownership of the areas that are messy, right, in our
Yeah.
behavior, in our lives, in our thoughts. There's a lot of freedom in being able to say exactly what you just said. Oh, my teenager was my inner teenager was angry and having a moment. I'm
Uh-huh.
sorry about that. Let me clean up the
Right.
mess that we made. And there's enough compassion there to be able to move through the rest of the day, the rest of the relationship without needing to be punitive or self-restrictive or deprivational in some way as a way to kind of make up for that mistake.
Absolutely. Yeah, it becomes like a domino effect.
Yeah. Yeah. Well, let's talk a little bit about desire discrepancy. I think this comes up for folks no matter what their gender is.
Mm-hmm.
But I work with many men who kind of struggle whether they are the lower desire partner or the higher desire partner. They seem to have, of course, this is a gross generalization, but they seem to have a little bit more difficulty in finding a way to reconcile those differences and negotiate for something that's sustainable for all partners. And I wonder, how do you approach that with men, and what are you seeing?
Yeah. Regardless of what side of the spectrum that they're on of the desire discrepancy, I first want to acknowledge the frustration that they're feeling. Either the pressure that they're feeling to have sex with their partner, or the frustration of this is really important to me, and I've named it a bunch of times, but I don't know what else to do without causing more of a disruption, or frustration in our relationship. And so I would kind of meet their emotions there. And then one psychoed piece that I like to bring in is from Martha Cowpea.
Mm,
And for listeners, she's a great sex therapist in the Midwest. And she talks about the linear model of sex versus the circular model of sex. And so I talk a lot about that piece, where the linear model of sex is kind of like this escalator where, it's like the bases that people talk about.
mhm,
And in order to move through the linear model, the previous step needs to work. And then trying to define, okay, well, what does work mean to you? And then the circular model of sex, I mention as like this 1970s rotating furry bed of love. And on the edge is all these options that you can choose from. And, not one of them has to lead to another type of sex act or an orgasm or whatnot. And talking about those options within there, and also highlighting that, understanding your accelerator and brakes, your turn-ons and turn-offs are really important there. Knowing that you're going to your nervous system is going to get ramped up, and then sometimes it's going to come down again. But really kind of expanding the definition of intimacy, expanding the definition of sex, acknowledging, like, if they're the higher sex drive person, great, penetration is great, or orgasms are great, but there's also all these other things that you can do. And so really trying to expand all of that, to help them understand that, there's many different ways to go around this, so that it's not just this kind of one option. It gets frustrating when we try and it doesn't work, and then we just stop, and then we're disconnected. What I'm really trying to do is keep things warm between the partners so that they can stay connected and close together.
Yeah. I think that's a really important piece, right? So much of what I think gets lost in desire discrepancy is the way in which people are trying to connect, right? And often the higher desire partner, sure, do they want to have sex? Yes, but what else do they want through sex? And often it is that desire for connection, and sex is a vehicle that they feel safe enough to sort of move through to get that connection. And so when we are able to parse that out, suddenly there are all these other opportunities for connection and ways to stay close, and, as you put it, warm with each other. And that relational safety is often what can help the lower desire partner feel more excited about sex and engaged in sex. And so it's kind of a paradox, but when you can look at what else is underneath the sex and what sex is doing for you, then maybe you'll actually have more sex.
Right.
Yeah.
And like you're saying, with the lower desire person, what's going on that's preventing them from feeling safe enough, from them feeling relaxed enough, to be present in whatever type of sexual acts that they want to do.
Yeah. Well, let's talk a little bit about anxiety closeness, especially anxious attachment in men. What does it look like, and how are you seeing it show up with men as opposed to how it might show up differently in folks of other genders?
Yeah, we do see a lot of avoidance, and I think that's related to the shame, that's related to not being able to access emotions, or having a different relationship with learning, where they're a little more strict on themselves. And so the avoidance can look like, relationships or dates going really well in the beginning, but then over time they kind of start to pull away as things deepen. It could be, hooking up a lot, or having just like one, first dates, as a way of kind of maintaining that connection, continuing that connection. But then also it can just be kind of going into their own world and isolating in a way. And then looking at whatever, like, narratives or thoughts are around that, maybe it's, I can't find anyone good enough for me, or I'm not good enough for anyone else. What is it that's going on under there that needs to be kind of sussed out and understood and challenged?
Yeah. When you think about kind of the difficulties that men face as they start to embark in this work, what are some of the things that you see as the biggest impediments, and how do men usually start to push through that or work through it? I don't want to say push.
Right. Yeah, I think if you're the kind of guy that is new to this type of work, it's important to know that it's not going to be this transactional quick fix. That this, as much as we're in the medical model, it isn't very much the medical model where you come in and you get kind of a prescription and then you go and you're good. That this is a lot of continued work, in session and in between sessions, where you are really kind of trying to understand yourself, trying to work with yourself in these ways.
Yeah. I know you're really passionate about exploring mental health for first generation and third culture men, and particularly queer men. I wonder if you can maybe speak a little bit to these different groups of men and some of the things that might be unique for their experience.
Yeah. As someone who, is third culture myself, navigating the many different cultures that you're holding, and you're also influenced by those various cultures' beliefs on sex and relationships and masculinity and emotions. And so working with those men to really identify for themselves, going back to, ACT, the values, identifying for yourself, like what it is that you like and don't like, who you are, going through the messages or narratives that you received about what it's like to be a man and what it's like to be someone of your cultural background. And then sussing through those and saying, okay, as much as we can work on this, what are these messages that you want to keep and what are these that you want to start to work away from? Because there can be so many competing different influences going on that it's really important to ground yourself in that moment and say, okay, what is it that I like? And then I think finding ways to integrate all of your parts as best as can be is really important. The first time I went to a Middle Eastern queer club night in San Francisco was an amazing transformational experience for me to hear, Middle Eastern music that I listened to as a kid at family parties, and then seeing, these beautiful queer folks dancing and celebrating to that music. It like was a true moment of integration for me. So I also try to talk with men around, okay, what are some ways where we can help you with that integration as well?
David, you have a retreat coming up soon in December, right? Can you tell us a little bit about it?
Yeah, so Rouse Relational Wellness is in San Francisco in the Castro, and we're going to be doing our first in-person men's retreat at our offices. It's a 2-day retreat.
I'm clapping. It's exciting.
Oh, yeah. It's a 2-day retreat, primarily focusing on anxious and avoidant attachment styles. We're going to have some movement classes in there as well to start the day. Some maybe looking at other providers to bring in as well to really round out the services. But essentially what it is help you identify what your attachment style is, how it's working for you, how it's working against you, and how to work through it. And then also there's going to be a big piece on consent at the end of the retreat as well.
Oh, interesting. So the goal I'm hearing is it's kind of a retreat that helps men think about intimacy, relational and sexual intimacy more holistically, and looking at attachment and looking at movement and embodiment, and then also looking at, of course, permissions and consent and autonomy and what that all means put together.
Yeah, right. Exactly. Yeah. The main umbrella is attachment. Yeah. And so that'll be December 2nd and 3rd in San Francisco.
Great. Can men come in from anywhere, or do they have to live in San Francisco?
Oh, no, they can travel in from anywhere. Yeah.
Great. So how can people learn more about you and your work? Where can they find you if they want to connect?
Yeah, we're at rousetherapy.com, ROUSE, therapy.com. We're also Rouse Therapy on TikTok, on Instagram, and you can check out our different workshops that we have and different offerings that we have for everyone out there.
Amazing. Please, guys, if you're listening and you've heard anything that resonates with you, please check out the offerings on David's website. There aren't enough services for men that really focus on the things that are unique to the experience of being men. And I'm just really grateful that you're here doing this work, David. Thanks for being here.
Thank you to you as well, Dr. Kate. Thank you for having me.
Of course. All right, everyone. Thanks so much for listening to another episode of Get Naked with Dr. Kate. I'll see you next time. Thank you for listening to Get Naked with Dr. Kate. Stay connected with me on Instagram and TikTok at Dr. Kate Balestrieri. Everyone has questions, and I want to answer as many as I can. So feel free to email your questions to question@getnakedpodcast.com. If you're looking for a free 30-minute consultation with me or someone on my team, visit modernintimacy.com. And don't forget to join our newsletter, Modern Intimacy, on Substack. Let's meet back here next week. A new episode drops every Tuesday. Disclaimer, this podcast is not a substitute for therapy and does not constitute a professional relationship with Dr. Kate Balestrieri or Modern Intimacy. This podcast is strictly for education and entertainment purposes only.